Hey everyone, Dr. Soren here. I want to talk about a topic that's very important and underappreciated, which is sleep and its relation to pain. So first, I'm going to go over 6 ways that lack of sleep can affect your pain. And at the end, we're going to go over 10 different tips for sleep to help improve your pain through better sleep. Number 1, lack of sleep can decrease your pain threshold. That means the level at which you perceive pain is going to be lower. You're going to be less able to handle pain if you haven't slept well. Number 2, it's kind of the opposite of that. It's lack of sleep can increase your pain perception. So that means you're going to feel pain more sharply if you haven't slept well. Number 3, it's a really important one. Sleep can increase inflammation throughout your body. When you sleep, your body is regulating the immune system and your body is healing. So when you don't get adequate sleep, your body doesn't have that chance for healing and immune regulation, and that's going to increase the inflammation in your body. Number 4, pain and sleep disorders go hand in hand. So if you have pain, you're more likely to have sleep disorders. If you have sleep disorders, you're more likely to have pain. So they are very much interrelated. It's a two-way street. Number 5, sleep can make pain management more effective. So if you sleep better, the medications you take are going to work better. If you sleep well, the injections, the interventions that are done are going to work better. So everything works better with sleep. And number 6, last one, emotional regulation. Obviously, we all know if you haven't slept well, you're less likely to handle your emotions well, which can affect how your brain perceives pain. So therefore, sleep is also very important to emotional regulation. Now let's go over 10 tips for improving your sleep. Number 1, have a regular sleep schedule. That means going to bed at the same time and waking up at the same time. And kind of related to that, you see sometimes people want to go to bed at 7 and wake up at 10. It's just your body doesn't need that much sleep. So you got to find a schedule that works for your body. Typically, they recommend 7 to 8 hours of sleep a night for everyone across the board. So 7 to 9 is the number. Number 2, create a sleep-friendly environment. That typically means a place that's dark and that's quiet. So creating that environment by getting blackout blinds and having a quiet room, or using a noise machine if you don't have that option of a quiet room. Number 3, limit or eliminate the use of electronics before bedtime. Now there's a blue light that's emitted that stimulates your eye and releases hormones that want to wake you up. So that's one reason the blue blocker glasses can help with that. But as a general rule, avoid electronics. They're generally stimulating and can affect your sleep. Number 4, avoid caffeine and stimulants. That's a hard one for a lot of people. Typically caffeine lasts and affects you for about 8 hours. So I recommend no caffeine at all. But if you're gonna have it, make sure it's more than 8 hours before the time that you want to go to bed. Number 5, create a calming bedtime routine. That means slowing down at a certain point. That means not discussing topics or even watching on TV topics that'll really get you fired up. Just maybe reading a book, drinking some warm tea that's non-caffeinated, and creating a calming, dimming the lights, create a calming, take a warm shower, those types of things to kind of create a nice bedtime routine to kind of slow you down. Number 6, if you exercise, you're going to sleep better. So you typically don't want to exercise right before you go to bed, but exercising regularly is going to burn off some of that anxiety, some of those hormones that, as you go through stress throughout the day, you need to burn those off. So when you exercise regularly, you're going to sleep much better. Number 7, your bed should be used for 2 activities, and they both begin with the word S, and one of them is sleep. So in other words, don't sit in bed and watch TV, read books. You really want to program your brain for when you get in bed, you sleep. So try not to use the bed as a hangout place, place to watch a lot of TV. 2 activities, sleep and something else that begins with S. Number 8, avoid large meals before bedtime. So again, if you eat a huge meal, then your body's going to be digesting this big meal. It's going to take blood flow away. can cause indigestion, heartburn. You're not gonna sleep as well. So try to avoid, if you're gonna eat a evening meal, make it lighter, or eat 3 to 4 hours before you go to bed. Number 9 is stress management. That's one that I mentioned already, and certainly things we've mentioned like exercise, eating well can affect that. Not reading things, looking at things, talking about topics that are really going to get you fired up. Trying to avoid all that and being focused before you go to bed, I think, is important. So managing your stress can be very important for your sleep. And the last one I have is avoid napping. It's tempting to do sometimes when you're tired, but certainly when you nap, it can affect your sleep. So if you do nap, my recommendation is the way I did it when I was in medical school, is I nap in a very uncomfortable position. So that way I either put my head down on the table or just lay on my back with no blanket on a hard floor. So that way you're not gonna sleep for hours. Because if you get in bed and make yourself all comfortable and cozy, you're gonna sleep well, but you may not sleep at night. So then that throws off your sleep schedule. Well, I hope those tips help. Keep in mind, sleep is very important and underappreciated. Leave some comments if I missed something or if you have any questions. Take care.